An Epipen is an epinephrine auto-injector used for the emergency treatment of anaphylaxis, a severe, potentially fatal allergic reaction. Its mechanism of action is threefold. As an alpha-1 agonist, it causes vasoconstriction, which reverses hypotension and reduces upper airway edema. As a beta-1 agonist, it increases heart rate and the force of contraction. As a beta-2 agonist, it causes bronchodilation, relieving wheezing and shortness of breath. Use an EpiPen immediately with the acute onset of illness involving the skin or mucosa, such as hives or swelling, and at least one of the following: respiratory compromise like wheezing, stridor, or dyspnea, or reduced blood pressure with signs of end organ dysfunction like collapse, syncope, or incontinence. Also use it for a known allergen exposure in a person with a history of severe reaction, even if symptoms are initially mild. Standard dosages are weight-based. For individuals 30 kilograms and above, use the 0.3 milligram dose. For those between 7.5 and 30 kilograms, use the 0.15 milligram junior dose. For infants under 7.5 kilograms, dosing is weight-based at 0.01 milligrams per kilogram, typically drawn from an ampule, as no auto-injector is available for this weight. To administer an auto-injector, first pull off the safety cap. Second, hold the injector firmly against the outer thigh. This can be done through clothing. Third, push down hard until you hear a click and hold it in place for 3 full seconds. Fourth, remove the injector and massage the area. Critical post-injection steps are to call emergency services immediately. A second dose may be needed if there is no improvement in 5 to 10 minutes. The patient must be transported to a hospital for observation, as biphasic reactions can occur. Common side effects are expected and transient, including anxiety, tremor, palpitations, headache, pallor, and dizziness. Serious side effects are rare, but can include precipitating angina or arrhythmia in susceptible individuals. Key counseling points include the phrase, blue to the sky, orange to the thigh, for common EpiPen designs. Patients should carry 2 doses at all times and should not hesitate to use it, as the benefits in anaphylaxis far outweigh the risks of side effects. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.